Welcome to Team Gut Girls, the podcast for anyone who's ever unbuttoned their jeans at 10 a.m., mapped out every public washroom in a 10-kilometer radius, or wondered why one bite of food can ruin an entire day. We talk about bloating, constipation, diarrhea, reflux, nausea, abdominal pain, histamine chaos, and all the quiet gut symptoms you're told to just live with. Join naturopathic doctors Dr. Whitney Baxter, Dr. Christina Carew, and Dr. Dominique Vanie. Your gut is talking, and we're here to help you translate. You're with Team Gut Girls now. Let's dig in.
And before we dive in, just a quick note. This podcast is for educational and informational purposes only. It's not meant for medical advice and doesn't replace working with your own healthcare provider. We're sharing general information, not diagnosing or treating anyone. Please always talk with your physician or licensed healthcare practitioner prior to making changes to your health, medications, or supplements.
Welcome back to another episode with Gut Girls on our series about bloating. This is Dr. Whitney Baxter. I'm joined by my co-hosts, Dr. Christina Carew and Dr. Dominique Vanie. For this episode, we want to talk to you about some sneaky causes of bloating that are found in the foods that you eat. So these can be found both naturally in stone fruits, vegetables like mushrooms, stone fruits like avocados, peaches, but also in packaged foods like candy, gum, baked goods. So I'm talking about sugar alcohols, polyols. If you've heard of the FODMAP diet, that's the P. So this is things like xylitol, mannitol, and other things that you might now recognize on that pack of gum. As always, we're here to help you ask your doctor the right questions to determine, hey, could this be what's causing my bloating? So today we're talking about food that causes bloating, but if you've been listening to this podcast, you'll know that we love food and we try to not make it the victim when you present with bloating right away. There are so many causes of bloating and distension, and it's not always just the food. And because of this, we're not always recommending that you just eliminate food. So if you're listening to this podcast and you think this might be causing your bloating, still ask your doctor, still seek out a dietitian for some support. But after listening to this, you might think, hey, yes, there's some good clues that this could be the cause. So when it comes to these sugar alcohols or these polyols, they're just simply not completely digested in our gut. So they hit the microbiome and cause lots of bloating and gas or loose stools. Depending on your gut, depending how much you're eating all at once, but I want to talk to you about why that's happening in a little bit. So they can be commercially produced from sugars, starches. They're used as reduced-calorie sweeteners and are found in many sugar-free or diabetic candies, if you've seen those, sugar-free gums, that sort of thing. Okay. So why are they used in sugar-free items? Do one of you want to talk about this one? Christina?
Sure. So they often are used, sort of alluding to the diabetics, as a sweetener or a sweet taste kind of replacement for people that are trying to reduce their sugar intake, for instance, or have limitations on sugar intake, so they're often considered some of those artificial sweeteners. They generally have fewer calories, and so that's another bonus for them. They're often found in foods that need bulk or texture to retain their moisture or prevent them from browning, which occurs during heating. So they're used sometimes in ways to preserve our food so that it looks the way that we want it to. And they also can make that cooling sensation in the mouth. So if you think about mint gums and some of those, and they are presumably less likely to cause cavities, and they do not interact with plaque bacteria in our mouth. So there's lots of reasons why they're used, but maybe we don't know as much as we do about sugar about them.
Yeah. And we'll learn that they're not inherently harmful, but just something to keep in mind of how they get digested in our gut. So let's get more specific so you can start to recognize them on food labels and maybe of something you're consuming on a daily basis. Dominique, what are some examples?
I'm educating patients, I'm telling them to look out for the end of the word ending in OL. Okay, so OL, and if you could think back to chemistry in high school, your alcohol. So we've got erythritol, sorbitol, mannitol, maltitol, and xylitol. There may be others, but those are the main ones. And you also want to think about kind of like broadly where we would find them. We've started to talk about the sugar-free gums, candies, mints, as well as diabetic diet and keto foods. They are typically not as sweet as artificial sweeteners like aspartame, for example. When you're having that type of food, you're still gonna taste some sort of sweetness. They still are sweet. And, like they're also going to be found in baked goods, often cakes, cookies, pies, things like frozen desserts, sometimes ice cream, sometimes not, flavored jam. So, and even sometimes we can find them in fruits and vegetables. So sometimes they're found in things like prunes, cauliflower, and button mushrooms, which was a bit of surprise to me when we were looking into this. You can find sorbitol naturally in some foods like apples, pears, peaches, apricots, and some vegetables. Like there's a really big list. Fermented foods such as wine and soy sauce. When you're reading the package of gum, ice cream, cookies, you'll likely find that there's more than one type. So we find them pretty broadly in a diverse diet.
Yeah, and I like what you said. Just keep it simple. Look at the word, that OL, because you'll start to recognize some things on the things you're grabbing during the day. Okay, so why and how do they cause bloating, gas, diarrhea? Those are some symptoms that they can cause. Essentially, when they hit your gut, your small intestine, sometimes things are selectively absorbed or they have mechanisms to help it into our bloodstream. But these are just passively diffused. They just kind of sift on through. So if there's a large quantity, they're not all getting through our gut. So that's left to be a hole. And then this incomplete absorption of these foods are getting to our gut microbiome and literally getting fermented and producing gas. So for some people, it can just be a tolerance thing, kind of like lactose intolerance. So some people can tolerate more. But for this reason, sometimes you'll notice different countries that and even in some packaged foods, they'll have to say excess consumption could have a laxative effect. Handy to know. But this is why. Yeah, so if you're noticing like, hey, I do actually grab a muffin or a cookie more days than I'm realizing, or I'm having these like mints throughout the day after my coffee, if I have to be speaking to a lot of people, and you're noticing a lot of gas and bloating, like after lunch or things, it's nice when you start to track your symptoms to put these clues together.
These are also in a lot of drinks. So lots of like those alternative bubbly waters and alternative soda options. So sometimes when people are choosing option because it's more natural, it may actually, especially if your consumption rate is high, could be a place where you're accumulating them that you're not even realizing.
Yeah, that's a good point. Yep.
Yeah. Sneaky. Okay, so over the years, I've had a lot of patients ask me these things, or I've read about some questions. If they're causing these symptoms, why are we consuming them? Are they harmful? Do they impact our gut microbiome? So I want to break these down. Why are they being used as sweeteners if they trigger these gas, bloating, diarrheas?
Well, I guess marketing is part of it, right? People are looking for alternatives to sugar because sugar became sort of a villain in the marketing world. And then people switched to aspartame, and then aspartame became a villain. And so xylitol or something from birch tree seems like maybe it's natural. And so I think that's part of it. We also know that there's less calories. So certainly that's a draw for a lot of people who are looking for a calorie reduction, but still getting some sweetness tasting. And maybe they have less impact on insulin concentrations or blood glucose response. It kind of depends on what is it in. What is it replacing? So is in a food that already has a lot of calories, this just takes some out or avoids some of the package labeling because it doesn't have as much sugar in it, but splits it in between these alcohol sugars is a possibility as well. And then the GI symptoms aren't something that everyone experiences. And so just like any other food. Not everyone is allergic to peanuts. Not everyone is allergic to or sensitive to certain foods. And so we don't restrict them in diet. We just say, here are options that are available to you consumers. Choose what you are, what fits your diet and your lifestyle best.
That's a good point, right? Which is when we're going down the journey of determining what foods we're sensitive to, sometimes we can think about, oh, it must be gluten or it must be dairy. But I think the sugar alcohols really represent this group where it's not necessarily the first thing that we think about. And it's so spread out in our diet. So it's definitely something to pay attention to if somebody is having sensitivities to what feels like every time they go out and they eat food or they purchase something packaged or they've had certain drinks. Something to think about.
And it's not that you're like consciously adding it in. It's in a food, so you're not necessarily recognizing.
Good point. Mm-hmm. Yeah.
Okay, Dominique, how do they trigger that gut pain?
Mm-hmm. That's a good question. Yeah. So it has to do with what you mentioned, Whitney, like that passive diffusion through the gut wall. So they can be, a laxative if taken in high enough quantities. This may induce gas, bloating, abdominal discomfort in healthy people. And as well, and that's where it can be a bit tricky because we can see this in a normal, like healthy, non-digestive issue population, as well as in the IBS population due to what we've gone over many times before in other podcasts. It's this visceral hypersensitivity mechanism. As well, the sugar alcohols will have a slow and incomplete absorption. So that's an important point too. And everyone's gut is different and everyone's threshold of polyol ingestion to laxative or bloating discomfort is different.
Yeah. So that's where tracking really comes in handy, starting to pick up clues. Because
so Whitney, do they impact the microbiome?
Well, I went down some rabbit holes with this question because I was also curious about this too. So some of them, kind of like the FODMAP world, when we put someone on a low FODMAP diet, they're not every category of the FODMAP is built the same. They're different structures. So just even like in this category of the FODMAP diet, these polyols are all kind of absorbed differently. So studies show that isomaltose, maltitol, lactulol, xylitol can reach the large bowel and increase the good numbers of our bifidobacteria in humans. So that's something to keep in mind because they are also found in they're naturally occurring. So it's cool that there is some benefits. So they're thinking that these could have some prebiotic action. So they're actually fueling the healthy species of the microbiome. And then different clinical trials showed that lactulol may decrease populations of other things, Bacteroides, Clostridium. So there are some studies in human trials. The majority are always in mice. So we can always say, yes, that's the same for us. They have different makeups. They're going to digest things differently than we do. Their little guts probably have never seen a candy before, where ours probably already has. So we can manage it a little differently. But there was an interesting study in mice, and I'll just talk about this because maybe this can happen in humans too, where they essentially put them on an antibiotic round and then fed them a high-fat diet, and they found that they had more intolerance to these polyols. And again, that's just showing that, if we wipe out all of our species of bacteria and then we're feeding high amounts of things that can be really irritating on the gut lining or the species that are left over in this forest, as a patient described it this week, which I really loved. They're just going to metabolize things differently, and you're going to have maybe more visceral hypersensitivity. So maybe we'll see these studies in humans, but I think that's something to keep in mind too. If your microbiome has been impacted by medications, if you've had a colonoscopy, if you've had a stomach flu or something that has altered this ecosystem or this forest of species, you might be noticing symptoms where you hadn't before to the foods you eat. And same thing goes with these polyols because they are reaching the gut and they are getting fermented.
Have you guys read anything? Something, because xylitol will use it often bile reduction. So it actually opens some of the goopy stuff that holds all these bacteria in. And I wonder if some of the bloating or some of the sensation is because we've like kind of opened Pandora's box a little bit. And so in taking xylitol, maybe as a food additive, we're actually also doing some bathroom opening.
That's a good thought, actually. Also, the reason why xylitol is added to some toothpaste for that exact reason of it being a biofilm opener. I think maybe like listeners at this point will have a question. Okay, so if we have some sugar alcohols that we know feed good bacteria and then increase their populations, why are we sensitive to it? Because we want to have good bacteria, and isn't that protective? And the reason why is I think it has to do with the fermentability of the sugar alcohols to begin with. So like the issue is starting up a little bit higher is like you want to think about how things travel from the mouth to the esophagus to the stomach to the small intestine. And it's the fermentability kind of upper in the GI tract. So that's kind of the issue, even though it's feeding some good species lower down where we're looking up a little bit higher up in the GI tract.
Yeah. And it's probably a symptom of quantity too. So like if you're someone that eats like a whole pack of gum a day, you're going to have a different experience than someone that might have a pack a week. And so it's like quantity is a big comparison too, or how many of the foods that you're eating, these additives structured into them versus, once in a while.
Yeah. Yeah, totally. And all these things are built with other items, like even with gum. Yeah, it could be the sugar alcohol, or if you're chewing, you're swallowing more air, more likely. So that can also be a cause of gas and bloating. Or these baked goods, they might have other things that you're sensitive to, or yeah. All things to keep in mind. So this was a short and sweet episode. So we'll just kind of give you some practical takeaways about these sugar alcohols and polyols and if they could be causing your bloating or other indigestion symptoms. So just remember, they occur both naturally and commercially produced in candies, gums, baking, frozen desserts, and fermented products. So just look out for that OL word, the xylitols, the sorbitols, and start to recognize them in your packaged foods. They can cause a laxative effect. So especially in higher amounts, they can impact some people more than others. Depending on your tolerance, or if you have something called visceral hypersensitivity, so if you've been told you have irritable bowel syndrome, you can just feel more sensations in your gut, and sometimes your brain thinks that it's pain. So that can absolutely trigger discomfort. They are not harmful, as far as we know. Studies are always ongoing. Whenever I search something, I can find something from like a few months ago. So studies on the microbiome in our gut is always evolving. And they don't have negative impacts on our microbiome. They have positive effects overall. Most studies are still in mice, but it's not something to be concerned about. So let's talk about some ways of how to talk to your practitioner if you need some more support. You guys can jump in on this one.
You want to explicitly say, I'm noticing whatever symptoms, X, Y, Z. So I'm noticing more gas, bloating, diarrhea, pain, wondering if this is the food that I eat, or something like I've noticed when I eat more of the following. Can we do a lactose intolerance test? Is there a tool that I can use to track this? Is there an app that I can use to track this? Could this be gluten intolerance? Again, you want to, I think tracking somebody's diet for enough time to give them a representative picture of what their average diet looks like. And that could sometimes be 5 days, sometimes that's 2 weeks, whatever it is, like personalized to them. But really noticing if this happens after very specific foods like baked goods, chewing gum, ice cream, stone fruits, things like that.
And yeah, if you're noticing symptoms after rounds of antibiotics or after you've been sick, that can be totally normal. Still good to check in with your doctor, naturopathic doctor, whoever you're working with. Sometimes it is just a short-term intolerance, and as you slowly build back up this ecosystem of your microbiome, your tolerance, you can repair it over time, so that sensitivity might decrease. So we hope to empower you to better understand what could be contributing to the bloating and gas, and at the end of the day, help you read food packaging, which is always really handy. So we've included a reference with this episode of how to find these in packages, so you can check that out. Because knowing why you're bloating can just put you at ease and help you eat the foods you love. So even those treats, we're not saying avoid treats. if you can have the muffin. And if you know you're going to blow, sometimes that's worth it. But if you're chewing gum all day, like Christina said, if you're chewing a higher quantity or having a lot more of those candies, they can just stack, and higher consumption can lead to more symptoms. But they're not harmful. Understanding how to consume less may really help you. But again, thank you so much for joining us today for another episode in our bloating series. We hoped you learned a few things about sugar alcohols, and we sure love learning how and why certain things can impact our gut and teaching you how to feel better. Because after all, better gut health changes everything.
Thank you for joining Team Gut Girls. Like, follow, subscribe, and share our podcast with friends you think will want to know more about their gut. You can also visit us at teamgutgirls.com for show transcripts and more information, because better gut health changes everything. See you next time.